All right, here we are. So we're live. Hey guys, thank you for watching. If you don't know who I am by now, brother, you need therapy. But guess what? Good news. We have the perfect person today. So we have Dr. Terry Lynn Kim who is joining us today. We're going to have a little bit of fun. I'm not going to tell you guys how I met her. That's for later on. So if you want to know how I met Dr. Terry Lynn Kim, make sure you stay tuned. And we're going to introduce her in just a second. But I want to just get all fancy and honestly, you guys are part of us on this journey. So we are live on, let me make sure I did it right this time because sometimes I mess up. We are live on Facebook for my Facebook family. We are live on YouTube, Twitch, and X, formerly known as Twitter. So my wife, Emily, is in the background making sure I did it right. Sometimes I mess up. So Terry, you want to just say hi real quick and then we'll play the video and come right back?
Yeah, thank you for having me. I'm so glad to be here, and I'm looking forward to how all of this evolves during our time we have.
All right, guys, we'll play a fancy video. We'll be right back. The reasons why I do these breaks is to make sure that I did it right and I did it wrong. So we are now officially live on YouTube, Twitch, and Twitter on top of Facebook. So I was like, what the heck? I'm glad I checked. That's why I do these. So for those that are going to be jumping in on a live, do me a favor, tell us where you're watching from, what city, what state, or even what country. We'll try to acknowledge you guys. And if anybody has any questions, we'll try to reserve a time frame for questions. And anybody that's watching on replay, obviously post up your comments accordingly, and we'll try to answer them. Dr. Terry Lynn Kim, like I said earlier, I'm not going to tell you guys how I met her, but we're just glad to have her. For those of you that have been following me for a while, you know, we've had some really interesting, cool people on here, people that have TV shows in Alaska. We've had a couple motivational speakers. We've had cancer survivors. We've had a whole array. We have some breakthrough business owners that I was just able just to talk story with. And today, I'm just blessed and honored to have Dr. Terry Lynn Kim. I'm going to read something. And I told her earlier, Brian, there's no way I can make it through your entire credentials, but I want to read just so I can say that I introduced her correctly as much as possible. So Dr. Terry Lynn Kim, she's the founder of the National Center for Counseling Services and Training. She is originally from Hawaii and relocated to Nevada in 2021. She now services Hawaii and Nevada and plans to expand her services along the West Coast. So I'll leave it at that. Terry, if you can just introduce yourself and share with us your credentials and all that good stuff.
Yeah, sure. Thank you, Greg, for having me. So I just want to say, one, this is a very humbling introduction for me. I don't like to talk about a lot of my acclimates, but I want to say, just by God's grace, is that I have a PhD in clinical psychology. I also have a master's in philosophy of psychology and a master's in professional counseling and mental health, and then also a bachelor's in education. And so those are all of the actual credentials. I've been in the mental health field full time since 2015. It has definitely been a journey as I navigated into different areas of wherever that need has been. I try to just navigate myself in those areas of need. Several things that I have done, especially just within the mental health field, is I do a lot of work within the community. Back home in Hawaii, I have worked with Clubhouse, which is a mental health adult rehabilitation. I sit on the board as well for one of them. I also volunteer at different transitional shelters, providing a lot of pro bono services because a lot of people in that area kind of become somewhat lost in the system, and there's not a lot of services in these lower poverty areas. And then also just dealing with here in Las Vegas, I also have my private practice called National Center of Counseling Services and Training. I work with a whole variety of population from children to adults to individual counseling to couples counseling. I also work as an adjunct psychology professor at College of Southern Nevada, known as CSN, and I am a mentor for college students. So there is what's called Promise Nevada. It is a nonprofit organization that I participate with, and I just provide what we consider guidance and a mentor. And I stick with these students all the way until they graduate. And these students come from, again, lower social class, they come in broken homes, no family. Some of them come out of the system. And so this becomes like a family for them. And I provide that one on one for them just to assist in hopes that they're able to achieve these goals. And, everyone needs support. We live in a world that we need to connect, and support's important. And so these are just things that I currently do within the mental health field.
When do you sleep?
I do sleep. Sleep's very important. I go to bed at night. So I aim for my 8 hours of sleep.
Well, for those that don't know, and like I said, I'm not going to explain it at this moment, but I'll share with you guys how I met Dr. Terry Lynn Kim. It's kind of a funny story, actually, believe it or not. But to my Facebook family, thank you. There's a few of our family on Facebook. I just want to acknowledge you guys. Guys, I told Terry that I do want to talk about just certain things. But there are some questions that I had because I watch a lot of podcasts and things that kind of explain where we are now culturally here, not just here in the United States, but even on a global perspective. I can't remember his name, but there's a doctor that he was known for writing journals regarding, and this is not completely related just yet, but he wrote journals talking about statin medication and how he was ostracized and he was labeled after. And he's a very well-known doctor, cardiologist, I think is his actual terminology for his name or job title. And all he was doing was just explaining that we need more information out there for the people to make their own decisions. And he talked about even going through the pandemic, how it led to the increase in a lot of cases regarding mental health just because of mandates and just the way everything was handled. And I know it sounds weird to say it, but did your workload increase exponentially to the pandemic because of that?
Oh, yes, absolutely. So, of course, we know the pandemic created such a huge adjustment for everybody. And so, just having to deal with this new norm, obviously, we have seen anxiety, depression on the rise. Suicide has been on the rise. We also saw a lot of domestic violence, marriage conflicts that has all just increased because of the pandemic. And then on top of that, just the grief in general has been such an ongoing situation in the mental health since COVID as well.
Well, I know with what I do, with me and Em being home together a lot, there is some mental issues on my end. It's like we have to learn to not just be sensitive. And I just got accused before we went live. I forgot what my wife said. What did she say? You're rude. She said rude, and sometimes I don't even realize it. And I can't even imagine during the pandemic how many couples started to have to learn more about each other and how they are because they're used to not being home together so much. And I was going somewhere with that, but even with our kids, having them being home during a pandemic and having to teach them, I think for the first time in history, parents had to teach their own kids, it feels like. And it just that workload mentally, like we're good, but I can't even imagine someone that is not in a good place having to deal with that during the pandemic.
Right.
You know?
Yeah. And you can talk about even this situation and how did families survive during the pandemic on so many different levels, financially, emotionally, psychologically, spiritually, physically. All these components of what makes us has been somewhat conflicted with. And so, let's look at just families in general. Like you said, being together 24/7, one, no one really has like this space that they need in order for them to recover. And so you're dealing with that. On top of that, imagine parents who are now working from home, or if one parent's working from home, the other one got laid off, just that initial stressor alone. And then having to have their children and trying to homeschool. I know for me, it was rough even having to homeschool my children during the pandemic because I had to turn all of my clients into telehealth. So it's like 8 patients in a day. Then I have my children trying to get work done somewhere along there. It definitely is rough.
And you're a teacher, and that was still tough.
Mm-hmm. Absolutely.
One of my family members, and I'm trying not to let the cat out of the bag and how I met Dr. Terry, but one of my cousins back home in Hawaii, he mentioned that just how hard it was to teach kids, and teachers for the very first time had to, like, on the fly readjust organic curriculum into something that was tele curriculum,
Mm-hmm.
and it wasn't working because it's not the same as being there in person, and they had just different rules. I mean, it sounds silly, but like no farting while you're on Zoom. You know what I mean? Little rules like that that disrupts the flow of the class. And I know it sounds silly to say that, but I think just that the teachers having to deal with that. And you talking about mental health at home and dealing with issues and anxieties and problems. My brother had a famous quote that he came up with, and I don't agree with it, but it sounds funny. He goes, "You know what? All these guys with problems. The funny thing is, he said, if you give them $100 million in their bank account tonight, they're all of a sudden they're totally fine and happy." What would you say to that?
Yeah.
Truth? Well, yeah,
Yes. Can I add to that too, Greg?
yeah. Go ahead.
So, one of the things that in fact, I just had this discussion with my students this past week is looking how stress and pain is perception based. So, let's talk about just stress in general. And it's funny because I use that same analogy. I said, I can give somebody $100,000, and to them it's like, wow, that's so much money. I'm going to really live off great this year making $100,000. And then I can give somebody else $100,000 and they're thinking, like with inflation, what is that going to do for me? Right. And so it's all going to be it's how we perceive it, really. So even stress in general, because stress isn't tangible, it's experiential, right? So it's not like I can give you 8 ounces of stress, right? It's a
Yeah.
perception that we have. And so what makes us manage stress better is your threshold. So when people have a greater threshold, healthy sleep, good support system, believing in a higher self out of who you are. So of course, having faith in God, being able to have good habits, all of these things is going to help to increase your threshold. And then how we perceive stress becomes a lot less.
So going to thresholds.
Mm-hmm.
How old am I? Man, hon, you can type in the comments. So for those that don't know, my wife is in the background. She's managing whatever she's managed comments and techie stuff. Um, I think I was 37-ish, whatever I was. I got shingles. And I'm like, what the heck? So the doctor said, are you under any stress? I'm like, no, I mean, anybody that knows me, yeah, I may act silly and stupid, but if you hang around me long enough, like I'm not, at least I act like I'm calm. Um, and so I was like, I don't have any stress. And so he says, well, one of the causes of people getting shingles typically is stress that compromises your immune system. And if you had chickenpox before. And so after I thought about it, we were talking, I was like, you know what? I've been carrying a lot of stress that I tell myself I'm not going to let it affect me. And I don't know if this is a clinical way to look at it, but I was literally carrying that stress and not sharing it with anybody. And I was bearing that burden on my own.
Mm-hmm.
And I think what it did was it caused my body to be compromised. And I was 37, 36 with shingles. I was like, what the heck? I thought that was an old person's. But the funny thing about that is that walking through that, I I was at home for I was out 4 weeks. And the first 2 weeks, I was kind of tough about it. I handled it. But because I had to be isolated, I literally started to have thoughts of like, I'm sad. It was weird. Ask M, like I was like getting all like, it's kind of like, I don't know if M ever thought it, but I almost felt like, I felt like she was like, just suck it up. But I really felt that little tingle of, I don't want to say depression. I almost felt like that
Mhm,
though.
mhm.
And it all started with the whole idea of stress. And I literally thought, no, I'm not stressed, but I was carrying it and not sharing it or having someone carry that burden with me. And I think that's what led to that.
Yeah. And so even with that, let's talk about stress in general. Like you weren't aware of it, right? And there's several reasons that probably contributes to why you weren't aware of it. One could be just the fact that in a society that we live in, stress is something that's so prevalent that it just feels normal. So we don't realize this is stress. We think this is just normal living. So that's one, right? Contributing factor. I think another contributing factor is we function from a what's considered a dual track mind, which is there is a part of our brain that is aware fully, which is our consciousness, and then our subconscious that we are not aware of. And to be quite honest, there is a huge part of our mind that functions from the subconscious. And so, this is why I'm such a huge advocate for mindfulness practice as well, because mindfulness is the principle of just being aware and present. That way, you can tap more into your conscious state and function from that place. So, when you are able to be aware of these stressors that you've kind of are not aware of, it'll help you in the long run that you can start to implement some type of stress management skills to help work through these so that it doesn't lead into a situation like yours. And people don't realize that stress. What it does is it releases a chemical into from our brain into our bloodstream, which actually creates a lot of inflammation. And so part of that is it affects our immune system. It puts us at risk for heart disease, heart failure. It puts us at risk for even cancer as well. And these are all scientific evidence statements that I'm saying, not just out of my opinion, but true research that says this is truly something that occurs from stress. And stress is a silent killer. And I think it's good that people can be more aware of this because stress does create a lot of um, difficulties within our emotional, psychological, and physical health as well.
So two things got my attention. One was stress releasing that chemical into your brain.
Mm-hmm.
I'm guessing that would be anything that is like an oxidant or oxidizing type of chemical or something that would deteriorate cells, right?
Yes.
Well, here's a question. Okay, so if I am aware of existing stressors in my life, whether it's finances, whether it's relationships, the other question is, well, what am I going to do about it? And I feel like, and I'm talking from experience, there are some times where I feel like I can't do anything about it at this time. Perfect
Yeah.
example, my brother. Like for example, I've never done an itemization of my time until recently, and it literally broke my heart because as much as I love my brother, for those that don't know, we moved to Oregon to be with my brother because of a traumatic brain injury. And in the process of that being there for him, because he's in a different city, he's 3 hours away. Like me and my dad share responsibility of being out. So at one point, I was going out there every week, and I'd be out there 4 to 5 days at a time because dad was sick. He had shingles, believe it or not. Yeah, it's crazy. And so that with ministry obligations, we had to go to multiple cities and just to be available for ministry. We're not just pastors, but we're prayer leaders for a prayer network based in Oklahoma, and just all these commitments. And being there for my brother, when I finally stopped, I said, "Wow, I've been on the road 6 months out of the year in the past 12 months. I have not been home in my own bed for 6 months." When I did the time, when I actually wrote everything down, I said, "Oh my God." And I told Em, I'm like, that's insane. That one that God provided, obviously financially speaking,
Right.
but also um, was able to um, be there for my kids.
Mhm.
Because me being a father, I'm like, no, that's my job. And that's my job to be there for my wife. And it's like that was so heavy. And that's where I said, okay, knowing the stressors, knowing that I can't be there for my family, I said, what am I gonna do about it? I can't because I'm not home. And that's a legit stressor that I carried.
Mhm.
But one thing that I think God put in my heart was, okay, then start texting people like my dad I forget who else I had asked. And I said, when I'm not home, can you just be available? And that helped a little bit. But that all goes to say when you talked about dealing with the being aware of the stresses in your life, I was aware, but at that moment, I felt like I couldn't do anything about it immediately. I had to kind of navigate and figure out how can I deal with that, you know?
Mhm. Right. Yeah. And I think even with that, I mean, that's always going to be something whenever we're going through difficulties. The first thing that I look at is, okay, what is in my control and what's out of my control? Because if I'm going to try to put so much attention on something that's out of my control, it automatically is going to spiral into a very dark place because I'm fighting with something out of my control. So coming to this place of acceptance, okay, this is out of my control. So I can let it be, but we still have the ability to manage the experience that you're going to make out of it. So even if you're faced with factors that are out of your control, you're not fully out of control because what you're going to make out of it, meaning what are you going to focus on, right? What is your interpretation that you're going to pull from that situation going to be for you? And how are you going to choose to still live your life even though you're dealing with something out of your control? And so this is where I say when you focus on those things, these are things that are in your control. What am I focused on? Right? What is the value I'm going to make behind this? How am I going to conceptualize this so that it serves me health?
Mhm.
And even some of the pain and difficulties that we go through still can serve us health. And you say, well, that's a strange statement to make. And it definitely is. But if you think about it, character is never developed in sunflower pastures. Characters developed in very difficult situations. I mean, look at how diamonds are created and made. So, knowing that quality is produced out of pain, out of suffering, out of difficulties, out of challenges, just that mindset can help you to have hope and to persevere in these difficult times.
You know, now that I'm looking back at that, and I'll share a little bit more about how I met Dr. Terry Lynn. Um, we were messaging back and forth, um, and we were headed to Vegas for it was a business trip to meet with some partners of ours, and there was an expo. And through that communication, I had messaged Terry, and through our doing whatever arrangements we needed to make, one of the things that Terry had texted me, and I'm just paraphrasing, it was
Mhm.
basically, "How are you? Like, how are you doing?" And that was probably one of the most powerful little snippets of text that you could send anybody. Well, okay, through all of that, how are you doing?
Mhm.
And a lot of people don't realize how important just a little thing like that. And I think I have cousins back home that someone can go through a whole traumatic life experience of losing a loved one, and everybody will type paragraphs on Facebook or whatever. And um, my cousins back home, through all of the messages and text, they'll just type up, "I love you," and that's it. It's crazy. It's like, what? Everybody's typing, "Hey, I got a vision from God, and just wanted you to know I seen your dad riding on a white horse, flying through the clouds with a sword in his hand, majestic rainbows flashing out." And then my cousin goes, "Just want to let you know I love you," and how powerful those little things are, and that kind of cuts through a lot of those things. And I think we forget how valuable, just how simple those little messages can be, in the middle of all of that, you
Right.
know?
Right. Yeah. And to add that, and one is thank you for sharing that. And I'm glad to know that it can be, just a meaningful moment, really, to know you're not alone. And I think that's important because one part of our human nature is we were created to connect. And unfortunately, COVID, I think part of the difficulties with COVID is that we were put in a space that we became very disconnected and disconnected with people. And then there's another level of disconnect. And that disconnect is because of all the stress that we've gone through. People begin to and I'll share this is that when we become so overwhelmed, the way that our brain tries to protect itself is it disassociates, which is like a form of disconnecting with self. And so once we disconnect with self, then I can put myself in a very numb state so that I don't have to feel the stress. I don't have to feel the pain. I don't have to feel the worry. I don't have to feel the sadness or the grief. And so that disassociating kind of puts us in a full round of disconnect. And I say this because this is where we are kind of losing this part in relationships, in being able to connect and create meaningful moments. It's not even about meaningful relationships, it's meaningful moments. And I have personally am trying to develop a lot of meaningful moments, not just for myself, but for people that I meet, even in the streets. When I go to the grocery store, I always tell them, hey, I like your dress, I like your shoes, I hope you have a nice day, just to have these meaningful moments for people, because we don't realize is that people need people. And that creates a level of validation and also just that support, because we know that, okay, whatever I'm going through, I'm being acknowledged, and some type of acknowledgement that creates validation for people. And it just boosts people's moods. It helps them to cope if they're going through a difficult time, lets them know that, hey, I see you and I care about you. And that's important in this space that we're living in right now in this world.
What would you say to someone that is tucking away those things as far as like, honestly, I don't like using this word, but maybe I don't know, maybe it's my shortcomings. I don't like using the word is it self-care or,
Yeah.
but like they neglect self-care for themselves and they keep neglecting. What type of dangers do you think, what type of dangers does that pose to you mentally or physically, whatever, physically, mentally, to
Yeah.
continue put yourself out of the picture and take care of other people's needs but not yours?
Yeah. I mean, that in itself, we probably could do a whole separate, video on this. But I will say this just to kind of like briefly summarize it. Um, First of all, I want to say self care is not selfish. And I also want to say being selfish is not unhealthy. So there's a stigma on the word selfish in the sense of it's all about me. But sometimes we have to focus on self when we are able to navigate through self care. And self care is important because I talked earlier about this threshold. Self care is part of this threshold. It gives us room to develop resiliency, right? So that we can push through a lot of our difficulties. So that self-care component is important for everyone, no matter what you're doing, what career you're in, whether you're married or not married, have children, don't have children, it doesn't matter your age. Self-care is important because you are being intentional in taking care of yourself. And that can look like so many different things for different people. For me, my self-care is I literally need alone time. I like to be quiet. I like to either be in my office or be in my bed. I like to listen to a lot of like audio sermons, or I like to listen to the Bible, and I have someone just doing an audio talk over on my Bible app. But these are things that I like to do, or I like to look up random information within neuropsychology. And so these are things that just kind of helps me to become regrounded again. But someone else's self-care could be working out. Someone else's self-care could be shopping. And I'm not going to tell Emily that because I don't want you to get upset, Greg.
Yeah.
But, it looks different from person to person. But let's go into this. Now, what happens to the person that suppresses? Well, one is we process these stressors, we process trauma, we process events and situations cognitively through our thought process. That's our mind. but we store the emotional residue of those situations in the cells of our body because our body holds on to emotional memory. And so this is where a lot of times people that suppress things, I always say it will show up in the most unhealthiest and unwanted moment for you, right? So we see physical symptoms beginning to decline. I see it a lot with my patients that have post-traumatic stress disorder because of the trauma that they hold on to. It is stored in their body, and all of a sudden, over time, they end up using canes, walkers, bodies deteriorating. They have to have back surgery. They end up in a wheelchair. Their liver shutting down, kidney shutting down, heart problems, right? And it's all part of just the emotional trauma that's stored in the cells of their body. Another one too is we see it within people that end up, because they have not been able to deal with these things. One, they end up developing addictions, and addictions is actually a coping mechanism, right?
Yeah.
That's how addictions start. It's an outlet for someone who has an unmet need, and they cope with that with developing addictions. And addictions could be from drug abuse to alcohol to gambling to pornography, to even spending money, right? So addictions can look like a variety of things. And then also is the third one is going to be anger. And so anger in itself is a secondary emotion. That's one. It's not a primary emotion. So anger is a response to something deeper. Anger is not a root emotion. Usually the root is hurt, disappointment, neglect, abandonment, like these types of feelings that creates a lot of deep pain for people. And the brain says, I'm no longer going to be a victim. I need to be in control. So it creates anger. And so I see even anger outbursts in people when they suppress things in. So they kind of become punchy, on edge, right? People say, I feel like I'm walking on glass around you. And that just is a good indicator that they got a lot of stuff that they're holding on to that they need to unpack.
How would you describe the relationship between anger and fear in what you're talking about?
Yeah. Well, I would say, first of all, I think fear is some perceived threat. And fear, I want to also add, is not real, right? Fear is something that we perceive, we create, right? Now, when someone has a lot of fear, it can cause them to feel out of control and lead into anxiety. Okay, so anxiety we know is, again, that in a clinical term is also considered a perceived threat, right? Someone that has some type of feeling afraid, nervous, anxious. But when anxiety is not treated properly or addressed within that person, a symptom of that is irritability. So then irritability, when it is consistent, it leads into anger, right? So anger in itself, let's look at this. If anxiety causes someone to feel out of control, right? Which is part of, that's what fear is. Fear causes people to be anxious. And how our brain copes with that, right, is it feels angry. Because if you think about it, think about a time, and even for those who are listening and watching, think about a time when you felt angry. It feels good. No one can tell you anger doesn't feel good.
Oh yeah, it feels amazing sometimes. Yeah.
You feel like you're Hulk sometimes, right? Like I can be like, man, I feel like I can turn this car over. I can, whoever's coming at me, I feel like I could beat them down, right? I feel empowered. And that's what anger does, right? Anger helps us to feel empowered. It gives us a false sense of being in control, but really, we're not really in control when we respond from that anger. We actually become very out of control.
Right.
Right.
Hey, real quick, I don't mean to pump on the brakes, but speaking of pumping the brakes, Airboy 808 out in Hawaii. I gotta say pumping the brakes. He says, I love being hangry. We'll post it up on the screen. So there he is. Haven't seen him in a while.
Oh,
Yeah. But you're talking about being angry. Before we go to that, I want to talk about the angry part.
Yeah.
And the famous words of Yoda from Star Wars. And I know he had the flowchart wrong, but one of the famous quotes is, "Fear leads to anger, anger leads to hate, and he said hate leads to suffering. But I know he had the flow chart wrong, but he's onto something.
Yeah.
You know what I mean? It's like, okay, I get it, because perfect example, if my kid, if one of my boys falls off a tree, my immediate response is not going to cheer and say, "Oh, good job." You know,
Right.
although in one of my famous stories, one of my cousins back in Hawaii, uh, when his son would fall and hit his face on concrete, the first thing he would do, he would cheer on, "Yeah, good boy," and he'd be all excited and ignoring the pain. But most rational responses would be fear that they got hurt, um, but also that my immediate emotion after the fear of them getting hurt would be angry. Like, what are
Mm-hmm.
you doing?
Mm-hmm.
Like, why did you climb the top of the tree? And sometimes the wrong language comes out, being very transparent.
Yeah.
That's one of my struggles, but I totally understand the fear, the anger portion, and I think in moderation, anger does help us overcome certain things for a season. Like, it sounds silly, but when I'm at the gym um my last set, and if I can't finish it, the first thing that comes to my mind is pretend that my kids are under the car and I'm lifting this car up off the ground. And
Mm-hmm.
by the time I get to my fourth kid, I feel like I'm gonna break a muscle or break something, and in my mind, I start to get angry and like, all right, with the Hulk, and I lift that thing up.
Mm-hmm.
But I know that's not really the most recommended way to train, body anything. And I think you would agree, right, that the
Right.
anger is it's not a sustainable emotion to carry in dealing with these
Mm-hmm.
things.
Right. And I think also to look at just, anger obviously just tells us, if we look at what anger is on another dynamic, is that it means that we have an expectation that's not being met.
Mm.
So because
You
this
say that again. Say that again.
so anger in another dynamic is looking at it as, I have an expectation that's not being met. So you can have an expectation on a person, expectation on a situation, expectation on an event, expectation on, your career or your job or your church or the people that you are hanging out with in your social group. And so whatever that may be, you have an expectation. When that expectation is not met, we can automatically become angry, right? Like let's my for my daughter, for example, right? I told her, clean your room, clean your room, clean your room, clean your room. She's the only one out of, in my family that doesn't care to be clean. And so, having to work with that, I get angry because I'm like, clean your room. But it's because I have an expectation on her that's not being met. And so I automatically go into feeling angry. Now, we can still take that and go, well, Terry, why did you feel angry? Why did you go right into anger? Well, if you think about it, if I have an expectation that's not being met and it's keep being re-emphasized, it's not being met. Because a part of me too, and you can apply this in various situations, is that whenever we feel anxious, part of our coping is we set more expectations, right? Because it gives us a false sense of being in control. So I'm going to keep on re-emphasizing my expectation, and then my expectation is going to get more rigid because I'm mad, I'm irritated, right? And so I set myself up to being angry. But again, it goes back into this root of I feeling out of control. It's a control thing. But a control thing is also a safety thing. So I can understand that as well. Because if you think about us as humans and our survival mechanism, right? To keep self safe, we have to be in control of our environment.
You mentioned earlier, in regards to I forget how the flow went, but I wrote down addictions and
Mm-hmm.
um, I think dealing with codependency, and that's something that
Yeah.
like when we help open a drug and alcohol rehab center in Kailua, Oahu. That was one of the things that I had to learn about was how to navigate guys through codependencies and just understanding, that a lot of times, and I probably dealt with it a little bit more harshly and not from a clinical perspective because that's not my background. It's more counseling, getting certified as quickly as possible so we can
Mm-hmm.
legally operate a center. And so I do have a little bit of that, but it's honestly it's not clinical. But one of the things that I really saw and I want your input on this, was that for guys to be addicted to something and to be codependent on, let's say, whether it be pornography or being other things that, would help them cope with whatever they're dealing with, a lot of times I saw organically in person that a lot of it was a cop out.
Hmm.
And what I felt just through counseling a lot of these men was not that they didn't want to become better, is that there was that uncomfortableness or that fear of pushing through to fight for that desired result, to overcome that addiction or those codependencies. And but
Hmm.
I seen that a lot where guys would be, and they won't admit to you that they're afraid or they're fearful of, of pushing through. Like, perfect example, a guy that constantly smokes ice and sells drugs so he can make money. The truth is he can go out and get a job and work hard to get that money that he needs, but it's a never ending cycle. And one of the things I saw was in dealing with that is that mental aspect of, okay, I don't want to go through that. Like, it's too hard, or I'm afraid that I won't be good at it or be successful.
Right.
I don't know if that's a right or wrong way to look at it, but to put them in a category, well, no, just push through that. I think maybe that's old school. I don't know.
Yeah. Well, I think so. With what you're talking about, is the reason why it's difficult for them in that aspect would be because we are creatures of comfort. And so we're always going to cling to what's familiar. So just the fact of having to shift this new type of living is going to automatically put them in the unfamiliar. And what's unfamiliar is uncomfortable. And what's uncomfortable, we perceive it as unsafe, right? So that aspect, yes. Now, it really depends. I work with a lot of patients that struggle with a variety of addictions, and every individual is going to be different. Sometimes I can identify that this addiction stems from childhood.
Mm,
So again, go into their environment, not having their needs met, not having emotionally available primary caregivers, constantly moving from place to place and being disheveled, especially in Hawaii. We live with aunties and uncles and grandmas and grandpas and tutus. And so, a lot of that dishevelment can create a lot of anxiety and a sense of being out of control. Other times it could be just a trauma that they went through and they didn't know how to process that trauma properly or in a healthy manner. And so they automatically found something to cope with that led into an addiction. So in that case, like, let's say it's grief. My focal point would be for that patient to focus on the grief. If it's childhood trauma, it'll be focused on the trauma in itself, right? And then there's other people that, they kind of lived a good life, but it's more so, I was in the wrong crowd. And my crowd that I was hanging out with were prone to, doing drugs. And it started off as curiosity that led into an addiction. So now there's a chemical dependency in that. So in that case, what I would do is, one is look at these different pillars in their life to help strengthen. And then two, we would look at how to replace that, because their brain is getting a level of dopamine from every hit. So we want to find a replacement for that dopamine. So I would, whether it's working out or going and going back to school, or, I think I want to get married and have a family, right? So we find what's considered replacement to help so that they can get a healthier level of dopamine. And so it just goes case by case, person by person. But how we find what is the best treatment is, I got to look at the history of it,
mm.
right? As to how did it evolve, when did it start, and what was their past experiences like.
There was a saying I don't know where I saw it, where in regards to a physician or a doctor, I think it was a cardiologist, was talking about, and you just mentioned what is the history or what is the, and I don't know if I'm quoting this correctly, but he made the reference that you want to learn something about someone, you spend a lot of time reading charts or whatever, and whatever is in their past, in their even family history. And
Mm-hmm.
he said, like, usually 60 to 80% of the information you get from that will give you a proper way to diagnose or treat what they're going through.
Mm-hmm.
Would you
Yeah.
agree that that's kind of accurate?
Yeah, absolutely. And I can take this a little bit deeper, in the sense of, if I look at mental disorders, I always look at the family history as well. Because, we look at just the genetic component. And so if addictions run in your family, I can find that out from family history. That means you're more susceptible to addictions. If anxiety, depression, personality disorders, bipolar disorders, attention deficit hyperactivity disorder, if these things that I notice is in your family, then it puts you more at risk. And so certain things can help us to pick up already. So there's the actual genetic component. And this kind of goes into this nature versus nurture debate that we hear in psychology as well, right? How much of it is actually genetic? How much of it is biology, and how much is it environmental, right? And so if we look at it, I not only taking the family history to look at the biology and the genetic component of mental health disorders, but then I also look at the nurture. What was your experiences like? Because if I take biology, which is genetic, and I take your experiences, what happens is we have what's called epigenetics. And epigenetics is when we have an actual gene expression that changes because of the experiences that you have, right? And so I'm going to take this deeper for people that are struggling, those that are listening. You have the ability to cut off and sever this family history of disorders by being intentional and changing your behaviors so that you develop a healthier gene expression, and your children and your grandchildren and their grandchildren and so on will be less likely to experience these types of mental disorders. So, this is where we kind of go into like the whole neuroplasticity field, but it's something that I think can be very important for anybody just to understand. I know we kind of started off about addictions, but to know that there are ways that you can shift not just addictions, but various mental disorders that we struggle with.
I swear for a second, I was talking to Dr. Carolyn Leaf when he talked about the gene and even the neuroplasticity, because one of the things that Dr. Carolyn Leaf talks about, she has this beautiful description on trees. You ever seen those videos? She talks about how your thoughts are like trees in the brain, the electronic signals. And it's powerful how she said that the amazing thing about the human brain is that you cannot just sit there idle and not create a tree in your mind. There's always something being created, even in silence.
Yes.
And I think that supports what you said about neuroplasticity, how we can change. It's hard not to get biblical on this, but it's so powerful, like even without biblical reference, with how that neuroplasticity, and talking about how she talked about how our thoughts create multiple trees in I don't know the terminology, but that's what you reminded me of Dr. Karen Leaf talking about, that how our thoughts, and you made reference to the gene, what was it? The
expression,
gene
epigenetic.
expression. Yeah, epigenetics. And I believe that 100%.
Yeah. So even when we talk about this, I mean, those that are listening right now, how your brain was before you started to listen to where your brain is at now has already created a rewiring. You don't know it, but it's happening.
You got to say that one more time.
So everyone, whoever's listening, whether it's live or later on the recorded, what happens is the brain that you started off with when we just started this live stream, and where your brain is at right now, just within those 48 minutes that has passed, there already has been rewiring. You already created new neurons in your brain. So Caroline Leaf, if I think what she's describing is what I would consider like a neuron, right? Which is our atom cell. And so our neurons, we have like dendrites. And I don't want to get too medical, but I'm a PhD.
Do it. Just do it.
I don't want to bore everybody.
No, it's not boring.
It literally looks like a ball that has a lot of legs, right? And that's what our atoms look like. In the middle of it, we have our nucleus, right? And so the legs are the dendrites, and the dendrites is what's like either receiving information, or we also have the ones that are giving out the information. And so our body is made out of billions and billions of interneurons, billions and billions of interneurons. And, looking at these things, how it works is that everything that you are perceiving through your senses, right? So our senses is now traveling into our central nervous system, and it's creating it into our brain, and it's creating these messages. And this is what we consider our neural communication system, right? And so these atoms that you are developing are neurons. What's happening is every experience you have, and I say this even to my students, the brain you're coming into class with every morning is not the brain you're walking out with every afternoon from my class, from my
Although
lecture.
sometimes we question that for some people.
Right. Exactly. Like, hello, is there anything in there? But, this to me, just understanding this concept tells me you're never in a fixed state. You're never in a fixed state. So I can apply that to every situation, every feeling, every mood, every behavior. I am never stuck. Right. And so this neuroplasticity of what we're talking about is every time you have these new experiences or new thought, what's happening is it's going down into these neural pathways, and it's now sending these messages to other neurons. And so that's the branches that we have in our
And it's
brain,
called dendrites.
dendrites.
Hun, can you pull up a picture? I text you. Can you pull up a picture? Because I'm looking at it now, and it is cool looking. There's different colors and different ones I see. I think I'm the purple and yellow one. That's me. But yeah, Hun, can you pull up dendrites? I think it's called dendrites, right? Dendrites?
Yeah, dendrites. Mm-hmm.
That's cooler than the trees that Dr. Karen Leaf talks about. I never even heard of dendrites. So kind of looks like something you see in the ocean. Kind of like they call those things sea dragons or.
Yes. It reminds me, do you know, like, I know we both have kids, Greg. So like, our kids, sometimes they play with, it's like this squishy thing, and it has like a lot of these like legs hanging out. I don't know if it's a sensory toy, but that's what it looks like to me. Yes. There you go.
Oh, that's the ugly one. I want the purple one. Where's the purple and yellow? But no, so we're talking about dendrites, right? And there's, what is that? Axosomatic synapse.
So the synapse is, so this synapse is, how I talked about the chemicals that our brain releases,
right?
Right. Gosh, we have so many neurotransmitters. We have dopamine, serotonin, I have GABA, I have endorphins, right? And these are just common neurotransmitters. And so what happens is these neurotransmitters are actually created and released within our neurons. So here within, if you ever would open it up, gosh, I wish I had like a writing tablet because I could draw it for you. But it's almost like, it looks like if there is a soil and I'm going to dig up, I'm going to plant a pot, right? I'm going to plant a plant, right? I got to dig a big hole in there. So it kind of looks like this soil, and then there's holes inside. And so what happens is the chemicals kind of go in those areas right where you see the synapse. And so that's where the exchanges go within the intake of these neurotransmitters into our cell body.
So what is that axon hillock? What is that? Like a membrane wall? What is that?
Yeah, I don't know. I don't remember what an axon hillock is. I do know here we have the axon. So so you know how we have, gosh, I'm trying to move my marker as if as if you can see me, because that's what I do with my students. Okay, so let's look at the axosomatic synapse, right? So the chemicals that are released in there goes into the cell body, right? It's also coming from our dendrites, it's our messengers. So it travels down into the axon. It's also in this axon. This is actually where the chemicals are going into. And it goes into, if we follow this axon, it actually leads to other dendrites.
So how many dendrites do we have in our body? If you used to,
if you think about it, we just within our interneurons, we have billions and billions and billions. So it's ongoing.
That's crazy. And each dendrite, if to someone that's not super smart like me, in a nutshell, how do you describe a dendrite to someone that doesn't understand anything?
Sure. A dendrite is what we consider as, it's what gets the remember how we played telephone with the cup and the wire when we're young? Yeah. So a dendrite is like that. It's the telephone with the wire that goes to the other person holding the cup. You know the cup with the wire, and we go, hello, hello, can you hear
Yeah.
me? Right?
So the
That's
more of
different.
those we
Yeah.
have that, and whatever we're talking about, billions upon billions.
Yes.
That's
Yes.
crazy.
Yeah. This is how we all function, right? And if you look at our human body, it is truly and I always say this is it is so complex. But God, in his intricate design, it is complexity that is built upon simplicity. Because if you think about it, we are complex and whole, but if you can take the time to break things down as to just the cell, right, of who we are, there it is simple. It is very simple, you know. And so I share that because this is how I can help people to start to kind of pull them into this learning of who am I? What am I? Right? Because it helps us to really understand not just self, but you can't really know self, to be honest. And I'm going to say this, whether you're a believer or not, but you can't really know self until you know God. Because when you know God, who your creator is, you'll be able to identify who self is. So when I do Christian counseling, they're like, I don't know, I lost myself. And I see this a lot, people that are going through retiring, or they went through a huge shift and transition in their life, or parents that their adult children are moving out, you know, and it's like, I lost myself, you know. And the number one thing I would say is seek God first, draw closer to him, because I can't help you to know you until you can draw closer to God, because he is your creator and he's going to help reveal who you are because he made you in his image.
Now, let me through this song. I was looking at while you're talking. You're talking about knowing self, and I'm paraphrasing for me to understand, but you will never truly know yourself until you know God. And that's coming from a Christian perspective. So not everybody may subscribe to that, but I want to read these lyrics. And when I first heard this song, it broke me because, and even now when I read it, I never really read it, but we always sing it. It's a song called Defender. I don't know who wrote it, but the bridge is so powerful. And the way the girl sings it. So this is the lyrics. She said, "When I thought I lost me, you knew where I left me." And this part, this part breaks me every time. She said that you reintroduced me to your love. You picked up all my pieces. You put me back together. You are the defender of my heart. Now I know the script lyric wise is saying heart, but it really talks about sometimes we don't even know where we are, right? People talk about I lost myself, gotta go find. No, you don't have to find yourself. Go find God. But that song confirms what you're talking about. How it said that when I thought I lost me, you knew where I left me. You reintroduced me to your love. And I was like, okay, I know we're not preaching today, but we kind of are. But I think it's powerful to put into perspective. If you really want to know who we are, you've got to get to the source.
Yes.
Because if it's all about self validation, then we'll always fall short. Always. Yeah.
Absolutely. And I think even with that too, let's even just take it within a mental health topic, right? Many times people, when they're dealing with mental health symptoms, right, like anxiety, depression, grief, addiction, is they think that the help has to be on the surface level, right? If I can just feel happy, if I can just stop feeling anxious, if I can just stop being angry, you know, and those are all surface level. If I can stop doing drugs, or stop drinking alcohol, or stop gambling, or stop watching pornography, right? All these surface level things, but you got to get to the root. Otherwise, what happens is, you know, you're going to, in 6 months, in 12 months, in 2 years, guess what happens is that these patterns are going to resurface over and over and over again. And I say this, you know, I always ask patients, like, have you been to therapy before? Right?
Yes.
How long? What did you work on? What did you find most helpful? right? And I'm like, okay, so we've been dealing with addictions for the last 6 years of your life and you're not getting better, right? So to me, I automatically think we're not getting to the root issue.
It's funny you say that because we were talking when we were in Vegas. We talked about how dealing with the addiction realm.
Hmm.
Uh, and I'm not speaking negative to any of the people that I counseled in the past because this is obviously anonymous. But a lot of the things that we deal with is okay. Are you here because you want to be here, or were you court ordered? You know, is that something you got to complete rather than dealing with the actual root issue? You know,
Right.
and it's funny you say that dealing with the root. Well, how many times have you been counseled before? Those kind of questions, right?
Yeah, and that's a huge indicator. I always assess for motivation in my first intake, right? Because I do have court ordered patients that I still see. And so, when it's court ordered, it is hard if they're just doing it just for me to sign off a paper. And that's going to be the reality of it too is, they say, well, my wife sent me to therapy, or my husband sent me to therapy, or my parents sent me to therapy, or, everyone in my life thinks I need it because I'm just having a difficult time. But if you're not able to come to this place of acceptance that, hey, I'm at a place in my life where I need help and support and some type of insight, and I need to go through some type of like healing and letting go of some things that I'm carrying on, until you get to that point, what we do as clinicians in therapy will only get someone so far to the level that they want to get help, or to the level they're going to accept that help, right? And that's hard. It's scary because a lot of times people are in denial because they can't face it, because it's too
Hmm.
difficult to
Hurts.
face that pain. It hurts too bad. So they're going to say, I don't want to get re traumatized again, right? I don't want to start unpacking all this and remember. And that is hard, But the one thing I will say, if any of you that are listening, and that this might, be somewhat similar to what you're going through, is I will say this is that the sooner you face the pain, the sooner that pain will start to dissipate. Why? Remember, we talked about earlier, like people that suppress. What happens is that emotional impact and trauma and residue is stored in the cells of your body. So you may want to cognitively try to let that memory go, but your body's going to carry and hold on to it. So the sooner we face it and then working on some strategies in session, you actually will allow your body to create space to let it go from session to session.
I want to kind of pause that and kind of shift gears real quick um, to someone that maybe and we've been talking for a good hour now. For someone that doesn't necessarily have a need, what we're talking about. But I want to put this up on screen for those that don't know. And Terry, you can explain while I'm putting it up there. And so I, I've wait, which one should I put up? Which
It
one is
doesn't matter.
better? Does it matter?
They're both the
So
same.
can you
Mhm.
explain this one here and how that might be applicable to someone what I just said that maybe they're not personally going through any mental health issues?
Yeah, absolutely. So, this is a training that I do. I'm an instructor for the National Council for Mental Well-being. And this certification, what it is it is considered a mental health first aid certification. And so, just like how we have CPR certification, this is, or first aid certification, it is, you become a first responder with an immediate crisis. And the reason being is, if I just look within mental health in general across the US, and this is across all nation, a lot of times people don't get the help because, one, they don't realize they need help. Two, the stigma of getting help. And so they're afraid to request for the help. Or three, they don't have access to that help. And so, mental health first aid certification, what it does is it will certify you. It is a skills based training that teaches people how to identify, understand, and respond to the symptoms of mental health and also substance use challenges. And so, when you're able to pick up these common signs and symptoms or challenges, we actually teach how to properly and healthily, without implementing any judgment or stigma, how to help a person in crisis, and then to also connect them to the help that they need. And it does go a little bit more in depth. We talk about trauma, we talk about substance use, self-care. Also, we'll discuss, anxiety, depression, just to help people understand, just on a surface level, certain mental health disorders and what those symptoms look like. I will say this is that people have asked me this. Well, does that certify me to diagnose people? No, not at all. I wish that
Yeah.
would be so, because then I wouldn't have to go through years of schooling and different board exams. But no, it doesn't give you the ability to diagnose. It also does not give you the ability to treat, but it does give you the skills to become that immediate crisis responder. Also, it gives you certain understanding and knowledge just to help stabilize someone and get them into the right place of help. This is good for anybody. One, you have to be 18 years and older. That is the requirement, and you have to be, of course, living in the US. It's good for employers, police officers, hospital staff, just first responders in general. Even just anybody that's within a community or a church or some type of organization, even schools, right? This can be very helpful. This training that I do, that I provide, it does give you a certification at the end. And the certification is not from me. I just sign off your certification. But the certification actually comes from the National Council for Mental Well-being. And so this is where your certification will come from. It is a blended course. So whenever individuals or participants register, there should be information on there as far as the registration, but it does come, there is a actual online link that you're going to get with your academic portal with all of the modules that we're going to go over. There's about 2 hours of pre-work that needs to be done. And then there are several classes I know that you posted on there, but there's also more. So I have other classes in the end of October and then November that also have just opened up. But what it is it is a self-paced course in the beginning for 2 hours, and then I do an actual live course, which is very engaged. So it's not like you have to just listen to me lecture. I am a very engaging instructor. And so I do this because my whole thing in helping people learn and develop and retain information is I try to make it meaningful. And this is what we call metacognition. So metacognition is when I can take information that you are learning, I can take that information and I can apply it to something within your long-term memory so that this information now is stored in your long-term memory. And so I call it, hey guys, I can help you hijack your brain. And I always tell that to all my students. And I do that by making class very engaging. And I ask a lot of reflection questions within that information that I provide. And so I say that because that is a 4.5 to 5.5 hour live instructor time that's led by me through my Zoom platform. There is the information on there for those who are interested in registering. Again, you can contact my direct line, which is my office line, 702-344-4696. Again, that's 702-344-4696. You can call or text. Also, my email address, which is office@nationalcentercst.com.
And we'll post we'll post it all in the comment section and description. And one thing I will be clear in this, and this is something that we share with our business partners, or we share with each other, is that if you're ever good at something, never do it for free. So guys, this does cost something, but we're going to offer a promo discount for anyone that feel they may need this. And while you were talking, Terry, it really led me to a lot of the events that we've had in recent years in regards to, like, one of them was shootings in different cities, where classic story where the the mother or grandmother says, "Oh, I didn't know that he was, dealing with issues or whatnot." And I think this would be great for people just to be able to identify, first of all, if there's
Yeah.
something going on, and not obviously to treat or diagnose, but just to be able to recognize behavior. Or because what you said in this graphic, it says 130 people die by suicide every day. Dude, that's
Yes.
like thousands. And that's just what's documented. I'm sure
Mm-hmm.
there's a lot more than that,
Mm-hmm.
you know?
Yeah.
So
Absolutely.
yeah, if you're good at something, never offer for free. Although we're doing this for free today just to kind of scratch the surface. I'm not sure how you did on time, but I know we didn't talk about grief. But
Mhm.
if you have time, we can talk about that, or we can do it at
Sure.
another time.
I'm good with time.
So let me take this off the screen. My mom passed away in 2014. Your dad passed away 3 years ago from this year. So what is that?
2020.
2020? Oh my God,
Mm-hmm.
that's right.
Yeah.
Okay, we'll let the cat out of the bag, guys. I didn't meet Terry like, because here's the truth. I'm like, nobody's gonna believe me that I know somebody that is a doctor who is a clinical psychologist. Like, they're not gonna believe that I have this street cred with somebody with credentials. The truth is, guys, she's family, so I cheated. But still yet, no matter, it's family. But
Right.
one, I'll say this, Terry. I'm so proud of you. Like, I'm not saying that from a elevated position, how I look down, but I'm like, bro, we're so proud of you. Like, just
Thank
what
you.
you've done. Um, and spending time with you guys in Vegas, and it's just, I couldn't be prouder of family doing or just exceeding. And Emma's about to join you in the ranks of being educated. So she's
Yeah.
working towards her master's, and Lord, we'll see where God leads.
Yes.
But we're so proud of you, and definitely following in the footsteps of your dad. I think your dad had how many? You have one PhD.
Mm-hmm.
That's it. That's all.
That's it. For now.
Amateur. But so for those that don't know, her dad had I think four, three. I don't know how many. I always say four,
Yeah.
but
So many.
he had three at least, three
Mm-hmm.
PhDs at least.
Mm-hmm.
And Lord knows he probably was secretly working on others before he passed. Who knows?
He got
You
his,
know.
yeah, he just got another PhD. In fact, it was 6 months. It was December of 2019. He got a PhD from college graduate um, in leadership, some leadership. I forgot what it was. So people don't realize that he actually just got another PhD and graduated in December 2019, and he passed in July 2020.
So we joke about. I have friends that I had a friend that went to school. I think like 9 years. So like, wow, you must have a PhD in something. No, I still have my bachelor's. So he was like a professional student. My uncle, Dr. Adrian Ewan, Terry's dad, was a legit professional student, like legitimate, like professional PhD student. And Terry is definitely not just following in her his footsteps, but I think you're taking it to another level because I think that's our parents' greatest dream is for their kids to not just do what they've done. It's not like I'm quoting scripture, but not just do what their mom and dad did, but to do it far greater and take it to another
Yes.
level. One of the proudest moments of my life was my mom being so proud of me doing a wedding, and it sounds silly, you know, but I always said, "I am not gonna be like." No, I told Em and I for years, we're not gonna be pastors. We're never gonna be. For let me just say never because that's stupid. Well, long story short, I had an opportunity to do a wedding for my cousin John Kavika because my mom was not healthy enough to do it. And one of the greatest moments of my life was my mom looking in my direction while doing the wedding and knowing that it was supposed to be her doing the wedding, but yet she was proud of me. And I was like, okay, this is cool. And and
Mm,
and we talked earlier in the broadcast how dealing with grief, I had asked the Lord, I need to be this is I don't know how correct this is, but I said, God, I gotta be strong for my family because when my mom goes, because the truth is we knew that there was a timetable. My
mhm.
mom, by the grace of God, defied all of the timetables given by the doctors. They gave her 3 to 4 months. She went on 2 years to fight. Um, but I said, Lord, I need to be stronger for my family because when mom takes her last breath, I want to be there for everybody. And so I think 2 weeks prior, I was in my dad's truck, driving around Kailua, driving around in circles, listen to some music, and it hit. I started just weeping and like, and let it all go. But dealing with the grief, the truth be told, that was nothing because there was a process, and it put a strain on my marriage, in many ways. Um, how would you navigate? I know you just, I know it seems like yesterday, but it's been 3 years since your dad. Now
Hmm.
that you're on that side of the spectrum, dealing with loss on a, you and I have been to, I want to just say hundreds of funerals just because of our affiliation with church. But now that it's our parent, it's different.
Hmm.
How did you counsel yourself with your education and navigate through that? How did you navigate through that?
Yeah. Well, I think one, having the understanding of what grief looks like on a clinical aspect, it just helped me to now put that information or that textbook knowledge into like real life situation. So it's almost like that information now became an experience for me. But even with that, it's not the same. And I say that because grief in general looks different from person to person, and there's no right way on how to grieve. Right. So people will think like, well, how come you're not showing emotion? Greg, why is it that you didn't cry? And how come I didn't see you crying at your mom's celebration of life? Or how come you went right back to work 2 weeks later and you kind of just picked up like life went on? Right. Like people have this preconceived notion of what grief should look like, but there is no right way of grieving, and everyone's going to grieve differently. I know for me, I had to really draw closer to God. In fact, there are many seasons in my life that God has allowed me to go through moments that positioned me to draw closer to Him. And when my dad passed was another season that positioned me to draw closer to him. And so I think me having to put my faith into something outside of this moment of pain and agony helped me to kind of keep my head above the water and just endure and push through. And that's hard because, my dad was so important to
Mm,
me, and I didn't realize how codependent I actually was on him, thinking I'm like this independent, daughter. But there was this emotional, psychological codependency that I didn't realize was a barrier for me in my relationship with Jesus Christ,
mm,
because I depended on him so much. And so when that sense of safety and that vehicle that helped me in my Christian walk, when that was removed physically, spiritually, he's still there, but physically, that was removed. I had to then be the one to draw closer to God instead of asking my dad, can you pray for me? Why? I could have just prayed to God myself, right? Dad, can you pray for me? I'm going through something really difficult. Or what do I need to do? I should have asked the Holy Spirit, what do I need to do? And so that's the codependency that I talked about that was taken
mm.
from me. So I think having my faith is what helped me to really push through in the sense of how to process my
Okay.
emotions. I see you.
Yeah, I had to point to faith. Sorry.
Oh, yeah. And so, on a clinical aspect, though, I think how I was able and still able to, because grief we know never goes away. And
Hmm.
people say, well, how come people say like grief gets better over time? Well, it's not that grief lessens over time, but I think we develop a better relationship with it because we start accepting it. And so for me, I had to realize how to accept the physical loss. But the faith component for me is what helped me to cope through, because I know this physical absence is not going to be permanent. But I don't want to sound in a way over spiritualizing. And so, even with that, I just want to go back and take it into just a mental health setting, is how do we cope with grief? And I think acceptance is one,
Mm,
and allowing yourself to feel all these feelings. Because if we're suppressing, This is what's going to lead to other mental health disorders,
You get
addiction,
shingles.
right? Shingles
Yeah.
in your case, right? So, but
It,
it definitely is a continued process.
is there a such thing as unhealthy grieving?
Yes. So, unhealthy grieving, which the clinical diagnosis, right, would be complicated bereavement or complicated grief. And so, this is when we look at if the initial grief experience is considered acute, right? And then we hope that from acute, it goes into what we consider integrated. So, integrated grieving is when we're able to accept the loss and continue to move forward. And I'm very intentional on using the word moving forward. Sometimes people will say, well, you got to learn to move on. But moving on has like this junk feeling of forgetting about that loved one that passed and just carrying on with our lives. But moving forward is the conceptualization that I'm going to now carry the love with me that I have for them and carry the memories that I have of them. So moving forward with those aspects of them to kind of help me in navigating my present to my future, right? And so saying that to you, I think that's going to be really important is people being able to understand, like, how do we move forward, right? That's really going to be important.
If good example, when mom passed, I was doing things. I guess the word would be moving on. I wasn't necessarily moving forward, and I was moving on things that maybe were not healthy.
Mm,
And you use the word codependency, and I've never actually used the word codependency in grieving. I've
okay.
always correlated with drug addiction because that's the background that I'm familiar with is the whole idea of codependencies and drug addiction and alcohol addiction. But what would be an unhealthy, if you could figure or explain, like, what would be like an unhealthy codependency when it comes to grieving?
Yeah. So, which I think that's what I was supposed to answer. And I just realized I didn't answer your question. So you asked me that, right? What is unhealthy grieving? And I think so what is unhealthy grieving, which is what we call complicated bereavement or complicated grief, is when the grief symptoms become problematic in the sense that you're unable to take care of yourself, you're unable to maintain the relationships that you still have left that are living, you're unable to go to work or fulfill responsibilities, and you find yourself in a very intense state of like depression or anxiety. And so these are what we consider symptoms of complicated grief or complicated bereavement. So that is what unhealthy grieving look like. So unhealthy grieving isn't the fact that you're still grieving 10 years later. That's
Mhm.
just grief. But if it's problematic for you, that it is now affecting you negatively in you fulfilling these types of responsibilities, tasks, and taking care of yourself, now it's considered a clinical, actual medical mental health diagnosis.
So, like,
Right.
impeding progress, for example, let's say I gotta be careful how I say word. So it's like, because I have some things in that we brought with us to Oregon that uh, are mom's stuff.
Mm-hmm.
Um, and that's not unhealthy for me. That's just little things. It's not a lot, but I do know that there are some people that will have entire homes and properties still with stuff that takes up space that could be used for other things.
Yes.
I
Yeah.
would call that unhealthy codependency or unhealthy grieving.
Yep. Which leads to what we know as hoarding disorder, right? So, to when is it considered a hoarding disorder? Well, when that hoarding symptom becomes problematic for you, it becomes an unsafe environment. That's one, right? So now we know that it's a problem. It's unsafe. When it also causes difficulty for you, sometimes people have aren't able to let things go. And so they just keep adding more, adding more, adding more, right? And so this is where we look at those types of things. And yes, that is now considered a codependent grieving process that leads into hoarding. Hoarding is also the root of hoarding, for those that don't know, is anxiety, which is feeling out of control. So for dealing with grief, if you're not able to come to a place of accepting the fact that this was a physical loss, and for whatever reason, this is the time and place and space that God has called that person home, and if we don't come to an acceptance of it, we're constantly feeling out of control. And when that's not addressed, then you're going to lead into hoarding. So even hoarding disorder is stemmed from unresolved grief as well, if I look at it. But the root is still anxiety.
So we got a question. It says, can anger be a form of unhealthy grief? That's our...
Yeah. Okay.
Emily asked the question.
Yeah, and I think that's a good question. So Kubler-Ross, he developed the 5 stages of grief. And so anger is one of those stages, right? So anger in the stage of grief would say, why did you leave me? I'm so angry. That's what anger would say, right? Where, denial would say, I can't believe you left me, right? Depression would say, I'm so sad you're gone, right? Bargaining would say, if I just did what you said for me to do, you would have still been here. Or, God, why can't you just take me instead of them, right? That's what bargaining would say. And then acceptance is saying, although you're gone, right, I can accept this time, this separation, and still know that you lived your life and my life is still moving on, right? And so anger, though, is just a stage in grief. Now, we talk about stages in grief. For those that don't know, we say there's 5 stages. Again, that's from Kubler-Ross, who talks about the 5 stages. I will say this, though, from a clinical aspect, I do use those stages of grief to help people understand and locate where they are in that stage. But I don't use that as a thorough, comprehensive treatment for grief, because I don't think grief just talks about those 5 stages. I think there is so much more to that. And I am personally learning, even just through research and through my clinical work of what I do, that I'm learning more about grief. And then my personal walk, I'm learning more about grief every day. And so I say that because looking at anger, right? Anger is not an unhealthy process or stage of grief. It's just telling us where you are based on what your thoughts are and that feeling that it is being created. So reason why grief can look difficult is because, or people say it's an emotional roller coaster, and I feel so emotionally drained, because depending on where they're at, someone can feel anger one minute, they can feel sad the next minute, or depressed, they can start bargaining the next minute, right? They can go into denial another minute. And so that in itself can become overwhelming. And then someone can also feel anger and depression at the same time. So depression is also interchangeable with the word sad. So let's say I'm sad and I'm angry. So sad will say, I miss you so much. But anger will come back and say, but why did you have to leave me? Right? That's complicated. I miss you, but I'm angry with you. It's a very distorted feeling, and that's what makes grief complicated. And so if I can present these stages to individuals and say, these are stages of grief, you can feel one from every second, or you can feel multiple all at the same time. It just gives us this sense of, okay, so this is all part of grief. That in itself becomes a buffer for people's grief process, because a lot of times we think, what's wrong with me? Why can't I just be okay and accept the fact that they're gone? Or why is it so difficult for me to move on? Well, this kind of helps people to put it into a better perspective. And that leads us to a place of acceptance. And that's where we want to get to a place of acceptance. And acceptance doesn't mean I don't hurt anymore, but acceptance means that we can develop a lot of resiliency and strength from this grief, right?
Well,
So,
it's like, why can't I be there for my wife or my spouse? Why can't I be available to them because I'm so wrapped around this grieving process? And I don't think I experienced that, but I do remember one of the biggest struggles I had was, I coach myself through my grieving. I had this whole plan. Anybody that knows me, I'm a very analytical person, so it's hard for me to
mhm,
not be analytical. I didn't say smart, but analytical. I'd like to, and one of the things that I had in my mind was, okay, God, I know that she's gonna go, and when she finally, passed, I said, I do not want to get to that place where I forgot about all the good things that I had experienced with her. And that was my biggest struggle, is like, okay, I don't want to forget those things. And I cried, like, it's like just heavy. It's like, I don't want to forget the time she left me in the parking lot and I was screaming bloody murder, like, I don't want to forget those funny moments. I don't want to forget that.
yeah.
And I don't know, now that I'm looking back, I don't know if I was able to understand the 5 stages that you talked about, or even many more,
Mhm.
because it's just something that I was just trying to navigate on my own. And I think what you're doing is so powerful, that you're giving people a roadmap, if you will, to walk through these things. Um,
Mhm.
and I know it sounds so pitchy, but bro, if anybody on the replay, you need some serious. If you dealing with a mental, bro, I'm telling you, go get some help. But last question, if we got time, is, and
Yes.
I preloaded this with Terry in the beginning, but like, so my brother, for anybody that doesn't know, he is um in a skilled nursing home in Gresham, Oregon, and so he has what we call a trach and a peg. He's got a tube to help with his airways, because he can't. He hasn't demonstrated that he's able to close his throat area to basically just swallow. And then he's
Mhm.
got a feeding tube as well. And then he also has the, what do you call that? The bag, the colon. My wife can type it out. That colony whatever bag.
Mhm.
And anyways, uh, from a kingdom perspective, we really know that God is a healer. We've seen it in scripture. We continue to pray and confess that. But I sound like I'm replinger. But in the shadows, in the thoughts of my mind, and even in the depths of my heart, when I'm praying, and I said, Lord, I don't want to be caught off guard, because I've walked through it. My wife has walked through it with her dad 20 years ago, and even to this day. And I'm just getting emotional. I never met the guy. I'm getting
Mhm.
emotional thinking about what my wife goes through at 20 years later. More than that, at the 20, holy smokes, 25 years. Wow. So her navigating through losing her dad back in 1998, and seeing that all those years ago, the grieving is still real. It's in a different time frame now. But in
Right.
regards to my brother, I don't want to be caught off guard. And I'm not saying that I'm confessing that, but look, if my brother's like, hey, you know what, God, I think I'm done. I think I've received what you want to receive. I'm ready. And so part of my question at the beginning was, is it wrong for me to be ready to grieve even though he's still alive? And I don't want to approach it like that, but because the reality is, I'm vulnerable like any human being. My heart is tender and as tough as I may look like on all my profile pictures on the Instagram. I look like a big tough guy, but the truth is, I'm vulnerable. And Lord, I don't want to be caught off guard. And is it wrong for someone to have those thoughts of dealing with that loss, not just grieving, but the loss, even though they're still here?
Yeah. I don't think it's unhealthy at all to pre grieve, as long as it is helping you to process, right? In that sense, whenever that time comes. Now, there is a, theological point of this, or a biblical worldview, because sometimes people can say, well, doesn't that mean that now you're doubting God and his miraculous power? And I think at the end of the day, we still know that thy will be done. And this is where God's will for Bryson, no matter what we think, is going to take place. No matter
Yep.
whether you pre-grieve or post-grieve, it's going to happen. Right? Like, you don't have control of God's timing for Bryson. And so really, this is not about you shifting or challenging the biblical aspect of what God has planned for him, but rather the experience that you're going to make for it. Now, I will say this to you, and I hope you're okay with me to just be honest.
Yeah.
Because I think, so I told you, like, I like to be real and raw with people. And so one thing I look at is your pre-grief, because it gives you a sense of control in the grief process. Something to think about. I'm giving myself permission to grieve now so that I'm not caught off guard. So is that more so a control issue, so that Greg doesn't have to be vulnerable in that moment, right? So in your mind, you're probably trying to conceptualize, well, obviously I'm going to pre-grieve so that when it happens, I can be rational. I can be a support to my other family members, like my dad and my children and my wife, so that you can become that protector of your tribe. And so, if that's not wrong either, right? But I bring up this insight to you so you can kind of think about, because if it is something for you to be in control of, it's actually going to add a lot of distress, because then you're not properly grieving, right? We're superficially grieving because you're trying to do it to help you feel in control, right? So that's when it will become unhealthy. I'll share a personal story with you. Is before my dad passed, I was part of the caretaker for him. And, something that I've learned was it was literally 2 weeks, same thing like you, before my dad passed. I heard the Holy Spirit tell me, Terry Lynn, be delicate with his care. And I was like, delicate with, it was an audible voice that I just heard in my mind while I was taking his chart of his sugar level and his blood pressure. And the Holy Spirit said, be delicate with his care. In that moment, I knew what that meant. I knew when I asked the Holy Spirit, be delicate with his care, I knew the Holy Spirit said, his time is coming. And those 2 weeks, what I did was I intentionally was present with my dad. I would finish work and then I would go home. I would make him his favorite chicken papaya soup and bring it to him. And then I would make joke and bring it to him. And then I would make chicken long rice, bring it to him, because I knew these were foods that he liked. And, for me, like, I like to make foods as like part of my love language as well. And, firsthand, my husband's the same way.
Yeah.
And so, for me, that's how I was able to just care for my dad. And it was how I was pre-grieving, because I was able to take this time that I had and be intentional in my care for my dad. That pre-grieving option or opportunity that God graced me with, because honestly, God graced me with that. It helped me to actually grieve when the time passed. It really did. And I think if I didn't have that prompt from the Holy Spirit, I think my grief would be a little bit more difficult. But it was peace. It was such the most intense pain, but the deepest peace I ever felt at the same time. And I think that is what makes grief in a biblical worldview so different from a secular worldview of grief.
To answer my own question, and you just verified, and it's hard for you and I to not infuse, because that's just who we are, infuse.
Right.
God, Jesus, kingdom, Holy Spirit, all those elements. But it just reminded me to, the scripture that that there is a season, a time for everything. I think it's Ecclesiastes 3,
Yes.
where it talks about that there's a season. There's a time to mourn, time to rejoice, time to be born, time to die, time to plant. And it led me to the word seasons. And so one of the things we're learning right now in Oregon is like, oh my gosh, summer is so short. like 4 weeks. I am not even kidding. But then it got cold, and then it got hot again, and then there's a fire yesterday. Like, what the heck is wrong with this weather? This is some bipolar weather. But it led me to the thought when you said that, and I think I answered my own question, and so I won't have to pay you for your services today. But um, there's a season, there's a time for everything, and there is a time to grieve and mourn for anyone living.
Yes.
But there is a time right now to rejoice and to declare in my brother's life on how good God is and what God is going to do. And I think that with the whole seasons, to go back to the seasons here in Oregon, my wife and Zoe are planting. I don't know what they're planting. Hon, you can type it in the comments, but they're planting all these things. And I keep telling them, you guys better hurry up because time's ticking. Like, we don't have that much
Hmm.
time because it'll start getting cold and it'll start dropping to below freezing. It'll start snowing. And it led me to this point where, okay, we're in a time where there are seasons, there are chapters that we all go through, and everything needs to be dealt with excellence as much as possible. And I think with you doing what you're doing, offering the classes, we're gonna kind of land the plane. I think it's a good point to land. Um,
Hmm.
the fact that we have services available, and I'm not sure how we'll talk about this. We can land the plane, but there's been an in my feed and social media. I don't know why they're sending it to me. I don't think maybe I do talk about it. But there's a lot of ads lately about self-care, and people are lining up for counseling services. I'm not sure
Hmm.
if you've seen those ads
Hmm.
where they can do it remotely,
Yes.
and it just shows people are hungry for answers in their own life, in their own walk. And do you have an opinion on those services? Because I honestly, I'm channeling all towards you at the end of the day. But what do you think of people? Do you encourage that? Do you not have an opinion like those ads you see on Instagram or Facebook?
Yeah.
People getting, yeah.
Are those like the talk therapy, like Better Help? Is that what you're
Yeah, I
talking
think yeah.
So it's like you can join and yeah. So I was when I first moved to Las Vegas, obviously I had clients from Hawaii that I was able to carry through. But I also, because I didn't start my private practice here yet, in order for me to provide services, what I did was I actually joined Talkspace and I was a provider for them for about 6 months to kind of hold me through that process before I was able to open up an actual physical location here in Las Vegas. And so, do those types of services help? Yes. In fact, they're very beneficial. Um, and I'm not against them. I think they can be very helpful for people because, one, you can get help within just as quick as sending a text message on the apps, right? And there's so many different companies out there that provide that type of telehealth services. And some of it is just texting a clinician, and some of it is scheduling a 30-minute audio or video session or 60-minute audio or video session. And so I think those types of services are definitely helpful for people. But the one thing I'm going to tell you is that you also got to look at, one is that therapist or that clinician or that psychologist, if their approach fits with you. That's one, right? There has to be a good fit. Number two, the cultural sensitivity is going to be
Mm,
important, right? And I work with a variety of cultures, even immigrants. And that's, in fact, that's one of my passions is multiculturalism. I even have it in my website. I love multiculturalism. I take variety of training classes on multiculturalistic approach in working with patients. It's important. And so those things that you got to look at as to whether or not it becomes a good fit. So whether or not it's going to serve you effectively in what you're looking for. Right.
so basically they're legit because you obviously were a part of that, so that's
Mhm.
good.
Yeah.
And you're also a professor at the college there, right?
Yes. Yes. Yeah. At College of Southern Nevada.
Okay.
Hmm.
Guys, it all leads to the point where my just my pigeon comes out now that I can say we're family, but I'm so proud of my cousin Terry.
Thank you.
Um, she wasn't the first college graduate, but I think the second out of I think my our cousins Joe and Fred were the first
Yes.
college graduates. So, but yeah, like we're so proud of you. And I will say, if anybody is in a dark place, reach out to us on whatever social media outlet that you're watching on. I'll have my wife post up the website or email information. I can do it right here. So that's the email. It's office at nationalcentercst.com. Anybody that wants to, let me put it up, that wants to get a little bit educated and maybe become certified,
Yes.
become, let me put up the other graphics so I don't have to butcher the words. So if you want to become a certified adult mental health first aid, no, wait, that's you. You're
That's
the
me.
instructor. So that's
Yes.
her. But if you want to be taught by her, then
Mm-hmm.
so I think that's a pretty heavy plate we loaded up today. Um,
Yeah.
if anybody wants to attend the class and if finances are an issue, please reach out to me and let's talk. What I don't want is for somebody to feel that they need this, and we don't want finances to be a hurdle.
Mm-hmm.
We do have promo codes that will knock off X amount of dollars, and but if you're serious and you need something, then definitely we want to provide the way for you to attend. And of course, you do many more, right, Terry? So, Terry, I'll
Yes.
let you close out your end, and then I'll close out the whole broadcast in itself.
Yeah. Well, I just, this is really just a platform just to break any barriers within mental health, and people seeking help or those that want to help and don't know how to help. This is what the platform is all about for today. Is just to talk about these things. I do want to say, for any of you who are listening and you know that you are struggling and you might be in a dark space, if you think that you are in a crisis, I want you to know that you can always reach out to help. One, we have 911, right? That's always going to be our emergency line to contact. If you have intense thoughts of hurting yourself or hurting someone else, please contact 911 or go to the closest emergency room. Another one that I like to use, because of COVID, everyone became more tech savvy. A lot of my adolescents and high school patients enjoy this, even college age patients, is to text a crisis hotline. And so the text number to the crisis hotline is 741 741. It's only 6 numbers: 741 741. And you text the word home, HOME, all in caps. If you're living in Hawaii, you can text the word aloha, all in caps: ALOHA. Aloha is for our Hawaii residents. All other states, you can text the word home, HOME. You send a text message, and when you text those 2 words, depending on what state you're in, a crisis counselor will respond back to you immediately. It is free, it is 24/7 access, and it is confidential. So you don't have to give out any information, but they will help to stabilize you in that space that you're in, and then give you additional help in how to move forward with that assistance. So I definitely want to give that out there. And it's a good number for you to hold on to, because you never know, someone you might pass may need that information, and you share it along as well. But thank you, Greg, for having me. This definitely has been such an enjoyment just to talk real and raw within mental health.
And there's so much more that I had, but I think for the sake of respecting time, one of the things I'll leave this thought is have any, and I'm talking to the viewers, have any of you ever, just a fleeting thought of yourself driving off the freeway or maybe jumping off a building? I've had those thoughts and they come and go. It's not that I was thinking that, it's not that I was in a dark place, but that's something I want to let it stew. As I was watching a broadcast regarding that, this guy was talking about. It was a physician actually. He was the same guy. He's a cardiologist. I can't remember his name, but when he had expressed depression, he had those fleeting thoughts of,
Mm-hmm.
what if I just drive my car off the freeway, off the bridge? And those are
Right.
real things that people are actually dealing with. So that's for the next time. But
Yes.
Terry, thank you. We love you.
Thank
I
you.
didn't do any ads, but I got to pay bills. There's an ad, I'll play ad. So anybody needs a Archon mount, which is like a tripod mounting solutions for your car. There's a company that I partnered up with. They're archon.com. If you want to buy products, go to the website. We'll put it in the comments. It's archon.com. Promo code Hawaii. You get 20% off of all the products. I'll play the video, show off the products. Then we'll close it up with my fancy Lani Kai. We're going to close it with my Lani Kai video. So that's where me and
Yeah.
Terry grew up. So
Mhm.
guys, we love you. Thank you. Twitch, Twitter, YouTube, Facebook family. Thank you for tuning in. Honey, thank you for being our back end expert. She put up the crisis hotline. You can screenshot that,
Excellent.
everybody. And thank you guys for your time. Thank you for just tuning in. I know this is kind of an extended broadcast, but that's what we do. And there's a lot more that we can talk about. But Terry, once again, we're so grateful. After we end broadcast, we'll still be on the back. We can talk at the tail
Yep.
end. But we love you guys. Like I said, one more time, if anybody's in a dark place, you need help, do not neglect what we gave to you today and reaching out and contacting. There's all the information out there. So guys, we love you. Thank you. Until next time, Terry, thank you again. And we'll see you
Aloha.
guys soon.
Yes.